Knock, knock, knock. Hi, my name is Lisa. I'm going to be your student nurse today. I'm going to provide privacy, do hand hygiene. Can you tell me your name and date of birth?
Christopher Patterson, 12/31/98.
And can I see your wristband? Great, thank you so much. I got an order to do a head-to-toe assessment. Is it okay if I do that today? Okay, first, can you tell me why you're here today?
Just for a checkup.
Okay, and can you tell me what month it is?
September.
Okay, and is it okay if I go ahead and touch your head?
Yes.
Do you have any headaches?
No.
Do you get any head, or have you had any head trauma?
No.
Okay. So there's no noticeable hair loss, no skin flaking. Both sides are symmetrical. Okay, now I'm going to look at your ears. The auricle of your ears lines up with your eye. On your right side, I noticed that the skin color is equal to the skin color of his face. I don't see any redness, lesions, open wounds. I do notice a freckle on his right ear. The auricle of his left ear aligns with his left eye. No wounds, no redness, no discoloration. While I'm looking, I don't see any jugular vein distension on the left side. And no jugular vein distension on the right side. I'm gonna go ahead and have you cover your right ear and see if you can hear what I say. Do you have any hearing loss?
No.
Do you ever hear any ringing in your ears?
No.
Okay. I'm going to say
Peak.
perfect. And I'm going to have you cover your left ear and see if you hear what I say.
Ring.
Perfect. Now I'm going to look at your eyes, if you'll sit up for me. We're going to perform a test called PERLA. I'm going to first measure your pupils to see if they're equal in the size. Your pupils do appear to be equal and round. Pupils are round. They are size 5. Okay. I don't see any cloudiness in your pupil. Your eyes, the sclera of your right eye is a little red. I don't really see redness in your left sclera. Eyes are not protruding. Your lashes are out, straight out like they're supposed to be. No edema. So now I'm going to have you look straight ahead and we're going to see if your eyes dilate, your pupils dilate. So is it okay if I shine the light? So I'll have you sit up and I'll have you look straight ahead. So the right eye, it directly constricts, sorry, not dilate, it constricts, and then the left eye consensually constricts also. So now I'm going to do the same thing for this side. Is it okay if I shine the light in your eye? Okay. So I'm going to, so both eyes constrict. So right eye constricts consensually, left eye consents directly, constricts directly. Do you have any eye conditions?
No.
Okay. Do you have any blurry vision?
No.
Okay. So now I'm going to move down to your nose. So your nose is symmetrical with your face. Do you have any problems smelling?
No.
Okay. Do you get any nosebleeds?
Yes.
How often?
Once a week.
And are you on any medication for that?
No.
Okay. Can you cover your left nostril for me? And are you able to breathe?
Yes.
Okay. And can you cover the other nostril and take a breath? Okay, I do notice a little whistling whenever you breathe. Does it feel congested or anything?
A little bit.
Okay. I do notice your face is a little red. Do you have any skin conditions such as rash, hives? Okay. Are you struggling with dry skin?
No.
No? Okay. So now I'm going to look at your mouth. So if you can just smile for me. Perfect. I noticed both sides of his face raised bilaterally, symmetrically. Let's see, and it does look like under your eyes a little bit is a little wider than the rest of your face. So can you open your mouth for me? Perfect. Your right tonsil does look a little swollen. Your mouth does appear moist. Your lips are pink. Do you have any trouble swallowing?
No.
Okay. And you said you're not missing any teeth.
No.
And no false teeth.
No.
Okay. Let's see. Can you swallow for me? Perfect. Trachea is midline. No problem swallowing.
No.
Okay. Let's see. The skin color on your neck does seem even. So now we are going to move on to your respiratory assessment. So first I'm going to go ahead and check skin turgor. Perfect, it goes down immediately. I'm going to check for clubbing. No clubbing. I'm going to go ahead and check for capillary refill too while I'm at it. So no clubbing on either hand. I'm going to check for capillary refill, which is supposed to be less than 3 seconds. And it was less than 3 seconds. I'm going to go ahead and check your temperature too while I'm at it. Your temperature is supposed to be the same as mine. Temperature does feel the same. Feels warm. Do you currently have a cough?
Yes.
Do you cough up any mucus or
Yes.
anything? What color is it?
Slightly yellow-green.
Okay. Does it have an odor?
No.
Okay. Are you on any medication for it?
Azithromycin.
Okay. So I'm going to, I noticed that you're breathing bilaterally, your chest rises and falls equally. I'm going to go ahead and feel, is that okay? Okay. Perfect, my thumbs are separating, which is what they're supposed to do. I'm going to go ahead and listen to you if that's okay. When you feel my stethoscope, you'll just breathe normally. If you feel any pain or get dizzy, just let me know, okay? So I'm going to start with your mid-clavicular line above your clavicle. All lobes sounded clear. I did not hear any adventitious breath sounds. For the anterior portion, I would like to listen to you posteriorly, so if you could rotate, please. So when you feel my stethoscope, you'll just take a deep breath for me. And if you feel any dizziness or pain, please let me know. While instructing the directions to my patient, I did notice he's breathing and his posteriorly he's breathing symmetrically. So I'm going to go ahead and feel. My thumbs are moving, which is what they're supposed to do. So now I'm going to go ahead and listen. Starting at C7. Lungs sound clear, all lobes. So now we're going to do the cardiac assessment. So I'm going to go ahead and check your two upper and two lower pulses. So I'm going to check your brachial. Two plus regular. I'm going to check your right radial. 2 plus regular. Now I'm going to, I'll walk over and check your left brachial. 2 plus regular. Left radial is 2 plus regular as well. I'm going to go ahead and check your 2 bottom peripheral pulses. Do you have any chest pain?
Mm-mm.
Are you on any heart medication?
Mm-mm.
Okay. So I'm going to just go ahead and check your dorsalis pedis on your right foot. It's 2 plus regular. Sorry. I'm going to go ahead and check your left dorsalis pedis. 2 plus regular. I'll go ahead and check your posterior tibialis. I'm sorry. Two plus regular. Do that foot. This is your right posterior tibial, and that's 2 plus regular as well. Okay. So now I'm going to auscultate, or listen, I'm sorry. So I'm going to allow my client to be in a 30 to 45 degree position if they're supposed to be lying down, but we're in a chair. So you can just sit up straight for this.
Okay.
So I'm going to start on the right side, and I'm going to go to the second intercostal space. And this is auscultating his aortic valve. Now I'm going to go directly over to the left side and auscultate for his pulmonary valve. Now I'm going to go down to the third intercostal space on the left side and auscultate Erb's point. Now I'm going to go to the fourth intercostal space on the left side, which is the tricuspid valve. Now I'm going to go to the fifth intercostal space, auscultate for 1 minute while I measure the mitral valve, which is also the apical pulse. pulse was 86 beats per minute. That's within normal limits. So now I'm going to listen with the bell of my diaphragm to check for murmurs or adventitious sounds of the heart. So I'm going to yet again start at the second intercostal space. Listening for the aortic on the right side. I do not hear any murmurs. Now I'm going to go to the left side and listen to the pulmonary at the second intercostal space. I don't hear anything or any murmurs. Now I'm going to go to Erb's point, which is the third intercostal space. Now I'm going to go to the fourth intercostal space, which is the tricuspid. Now I'm going to go to the fifth, which is the mitral valve and the apical pulse, and listen. I did not hear any adventitious sounds. I am going to go ahead and check for edema on your bottom limbs, just to make sure. I'm starting from the bottom up. And I do notice your feet seem a little red. Look at this foot. This foot might potentially have some edema. There's definitely a little bit of swelling on the outside, so possibly 1+ edema. But I don't notice any on the legs. Okay. So now we're going to do your gastrointestinal assessment. When was your last bowel movement?
This morning.
Okay. And are you able to pass Pilates?
Yes.
Okay. I'm going to start with the right lower quadrant. Do you have any pain in your abdomen?
No.
Okay. And I noticed that my client's stomach is flat. So I'm going to start in the right lower quadrant and listen for sounds that are high pitched. So I heard sound. I heard sound again. Perfect. Now I'm hearing vowel sounds. Going to go ahead and listen to your abdominal artery. Make sure I don't hear any whooshing. No whooshing. And so now I'm going to go ahead and palpate. Sorry, one more thing. Palpate. Any pain, discomfort?
No.
Okay. Okay. Both sides are symmetrical. Stomach is flat. So, do you have any problems urinating?
No.
What color is your urine?
Clear.
Here? Okay, that's great. Now I'm going to go ahead and check your mobility. So, in your range of motion. So, we're going to start. Do you have any joint pain?
No.
Okay. Do you have any problems walking?
No.
Okay. So, I'm going to have you extend, and then we're going to flex. We're actually going to start with your arms, I'm sorry. So, we're going to flex and extend. So, extend, flex for me. Perfect. Now I'm going to have you do it with resistance. So, flex. And now, sorry, that was flex, this is flex. That was extend, this is flex. So, one more time. So, flex and extend. Perfect. And now I'm going to come over here. So, I'm going to have you extend and flex. Perfect. And now extend and flex Any problems doing that?
Nope.
Okay. So now I'm gonna go ahead and have you extend your wrist, flex. Okay, extend. Perfect. And now we'll do it with resistance, flex, extend. Perfect. And so now I'll have you flex, extend. Okay, so flex, and then extend. Perfect. Does that feel okay?
Mm-hmm.
Alright, so now we're going to do your lower limb. So I'm going to have you extend your leg, flex your leg. I got that. Alright, flex, extend. Alright, now with resistance. Perfect, extend. Okay. Now we're going to do the same thing with this leg. So extend, flex. Perfect. Now we're going to do resistance. Perfect. Does that feel okay?
Yep.
Any problems? Alright. So now we're going to do the same thing with your feet. So we're going to dorsiflex, which is go up, and then plantar flex, which is point your toes. Alright, I'll do it with resistance. Okay. Does that feel okay?
Yes.
Alright. So dorsiflex, plantar flex. Perfect. Now we'll do it with resistance. Okay, great. Is that okay?
Yes.
Alright, so now we are going to do a Romberg test, which is where I'm just going to have you stand up with your eyes closed for 5 seconds, arms at the side. 1. Perfect, you did great. And so now I'm just going to have you walk towards me on your heels with looking straight at me, not looking at your feet. Perfect. All right. So that is going to conclude our range of motion. Based on your answers, your eye contact, and your mobility, I'm going to give you a 15 for not hindered at all on your glass cow. For you were able to complete everything. You did great. I will get that documented. Thank you so much.
Thank you very much.